$50,000 for 3 stitches on a toddler's face, $9,000 for a simple blood draw, $13,000 just to be declared dead on arrival. Those are real medical bills that real people were forced to pay by big healthcare companies. Charges like those have become typical in America and only in America, where 1/5 of our national income goes to healthcare. But how can healthcare, insurance, and drug companies raise their prices so high without losing customers? If fast food companies did this, Americans would start making their own lunch. The problem is we can't make our own antibiotics, blood tests, or brain scans, and the companies know it. And because insurance companies choose our doctors and hospitals, and because usually employers choose our insurance, competition for customers won't bring prices down to earth. When you've just had a brain aneurysm and you're strapped to a table with doctors about to cut into your skull, you're not exactly in a position to haggle over price. That's how Wanda Wickizer got stuck with a hospital bill for $500,000. Wanda demanded an itemized accounting of her care and got 60 pages of incomplete nonsense, but she still had to pay. The companies have been taking advantage of us like this for decades, and today it's worse than ever, with a whole industry of consultants now inventing new ways of inflating bills every year. Why doesn't our government do something about this? Well, the companies have taken out their own form of insurance against government interference, and it works very well. For years, they've thrown billions of dollars at our members of Congress until they have become their members of Congress. They do this through lobbying, campaign donations, gifts to favorite charities, cushy jobs for family members, and jobs for the Congress people themselves after they leave office. It's worked so well that the last time Congress was pushed to fix healthcare, they passed a law forcing Americans to pay for private insurance, guaranteeing the companies massive new profits while Americans had to spend more of their dwindling incomes on insurance. More than half of Americans landed into high deductible plans that don't kick in until you've spent a ton of money. But not every part of our healthcare system is broken. The second largest insurance plan in America has consistently used its size and nonprofit status to protect its customers from price gouging and has remained streamlined and efficient. The name of this plan? Medicare. Medicare spends 98% of its revenue directly on healthcare while spending $0 on marketing or lobbying. Compare that to private insurance companies who've spent as little as 65% on care in recent years. Medicare has 97% of doctors and hospitals in network, and even though it's big enough to negotiate hard on prices, it pays providers generous prices far above what they get in other rich countries, helping to make America's doctors some of the highest paid in the world. Medicare was created in 1965 to insure seniors because private insurance companies were not providing them affordable coverage. Since all Americans are today facing that same problem, it makes sense to ask, can't we all just have Medicare? And the answer is yes. Medicare already knows our Social Security numbers. Why not just ask them to send us all our cards a little early? If you supported Obamacare, you should be automatically in favor of Medicare for all, because no matter how we end up paying for it, it's going to be a lot less money and less hassle than being forced by the IRS to buy expensive, high-deductible insurance plans. If you did not support Obamacare because you didn't want the government to be involved in the business of healthcare, guess what? The government is already in there and actively enabling and protecting the companies as they extract trillions of dollars, literally trillions, from our national income every year. If you don't want to pay for other people's healthcare, then you should support Medicare for all, because right now you're not only paying for other people's healthcare, you're also paying for the jets and yachts of insurance company CEOs. And under Medicare for all, you'll only be helping to pay for other people's healthcare if you're extremely rich. And you know what? If you're that rich, then you really should not be complaining, because we, the taxpayers, recently bailed out Wall Street to the tune of many, many trillions of dollars. And Wall Street is where you keep your money. Many of us even donated our homes. So please have some decency, stop complaining, and pay some taxes like the rest of us. Today, our Congress, including most Republicans and Democrats, is still bought and paid for by the healthcare, insurance, and drug companies. But the healthcare crisis is getting so bad, and the Medicare for All solution is becoming so blindingly obvious that scores of congresspeople have signed on in support. The Medicare for All movement is growing stronger every day, but it still needs you. Please see the description below for the latest news on what you can do to help make Medicare for All a reality right now.